A lot of people think it's just something celebrities do and they post it all over Instagram. But actually, there is lots of scientific research and studies out there now to support the IV nutritional therapy as beneficial to the individual.
Welcome to Forever Young, the health and wellbeing podcast from Lanserhof. My name is Mario Pederzolli, and in every episode, join me in conversation with a variety of health experts and special guests as we explore what it means to live well. We may not find the secret to eternal youth, but join me on our quest as we explore just what it means to live a balanced, healthy, and happy life. Hello again and welcome. In today's show, we will look at the growing trend for intravenous therapy, also known as vitamin infusions or vitamin drips, as a way to infuse various vitamins and minerals to your body more effectively. And it seems more effectively than dietary supplements ever could. How do they work? Are there any risks? And what happens to your body during a session? Well, no two of us are the same, and as such, a one-size-fits-all approach to vitamin and mineral supplementation is no longer enough. We are all aware for the need to take responsibility for our personal health in these challenging times, and now more than ever, we are looking for ways to optimize our well-being. And when it comes to supplements, often manufacturers claim or use language that might be confusing to consumers. Indeed, taking the wrong supplements can bring little or no benefit to our health, and often at great financial cost. To explore further, we are joined by the lead nurse at Lanserhof at the Arts Club, Rebecca Baird. With a background in emergency medicine within the NHS, working in major trauma hospitals in both Oxford and London, Becky then moved into private nursing and trained in intravenous nutritional therapy. 2 years ago, Becky joined Lanserhof at the Arts Club to manage the nursing team and run the infusion clinic. Becky, a very warm welcome to you.
Thank you. Thank you for that nice introduction.
My pleasure. That's what it said here. So, Becky, tell us all about it. Let's start at the beginning. What is intravenous therapy?
So intravenous therapy, it's a medical intervention that delivers fluids, medications and nutrition directly into a person's vein. Like you briefly mentioned, it's more commonly known for us as vitamin infusions or vitamin drips. So here at Lanserhof at the Arts Club, we offer vitamin infusions that contain vitamins, minerals, amino acids, and we deliver them for many different reasons, being immune system support, chronic fatigue, dermatology support, whatever that individual is looking to achieve through the vitamin supplementation, we can help out.
Okay, well, sounds too good to be true. They're gaining traction and popularity.
Yeah, very much
Let's
so.
Avoid the word trendy. But what exactly are the benefits, Becky?
Sure. So I don't know if you take any oral supplementation yourself, but with oral supplementation, your body only absorbs about 30% maximum of the dose that's contained in the supplementation. With intravenous therapy, where it's going directly into the vein and directly into the bloodstream, you absorb 100% of what we're giving you. So you will get 100% of the dose. They also provide 100% bioavailability, as it bypasses the whole gastrointestinal tract, which allows for full absorption of the nutrients. So with oral supplementation, it's got to go from your mouth all the way down into your stomach, and that's a long way for a pill to go. So you lose a lot of the benefits along the way.
You mean it just passes through?
Correct. Yeah, it just passes through your esophagus down into your stomach. But because we're going directly into the vein, we miss that whole absorption part, and you absorb 100% of what we're giving you.
So far more beneficial, far more efficient. And so clearly there's a mix. What exactly is inside the infusion? The infusion bag itself?
So it's all based upon a Dr. Myers. So Dr. Myers was a practitioner in the States in the 1960s who created a vitamin cocktail to initially help his patients that suffered migraines, fatigue, fibromyalgia, lots of different things. But then he also used these vitamin infusions to treat healthy patients with non-clinical indications. So he had this cocktail that contains vitamin C, it contains B12, B complex, B5, magnesium, calcium, selenium and zinc. And this is your basic recipe, so to speak, your basic infusion that we use to base all of infusions on.
So are all infusions today based on this initial formula?
Correct. So all of the infusions we offer at Lanserhof at the Arts Club, they're based on this cocktail. He liked to call it a cocktail of 8 ingredients. So it's just vitamins, minerals and amino acids. Okay.
Is that the formula you'd find anywhere beyond your clinic?
Correct.
Okay.
It's what should most infusion clinics base their infusions on. A lot of places don't because they just give you what they want to give you. But this Myers cocktail is researched and there's been lots of research about it, about the benefits. So this is what you should base all infusions on for optimum wellness, optimum health, and optimum well-being, so to speak.
Got it. Well, actually, we'll cover that later.
Yeah.
I think this is a worldwide trend and growing interest globally. But I've got here in front of me the menu of choice that you have, Becky, here at Lanserhof at the Arts Club.
It's like being back at a restaurant.
Yes, exactly. Well, starter, main and dessert. Maybe pick out a few that you recommend and why.
Sure. So like I said, the Myers cocktail. So the Myers cocktail is our life infusion. It's just our name for it. So it's the 8 basic ingredients for optimum health and well-being. So if you've never had an infusion before, this is a very good one to start with. It's not too complex. It's going to give you an energy boost. It's going to help with your sleep, and it's also going to boost the immune system. So it's just it's a nice basic one to begin with.
Yes.
Our most popular one is called the Life Plus infusion. Okay, so it has all the benefits of the 8 ingredients that Dr. Myers suggested, but we have added additional amino acids and additional minerals to this. So it's got the addition of coenzyme Q10, which is very good for the skin. You find it in a lot of moisturizers nowadays. It's got the addition of amino acids such as taurine and L-carnitine, which are proven to be good for energy enhancement and also muscle repair. So this is one of our most popular ones because it targets a bit of everything, and most people feel super energized after this one. It's a nice feeling. Actually,
probably a good time to ask, how often should you have an infusion, in fact?
Again, it very much varies on the individual and what you're looking to achieve. So this will be discussed with the nurse when you come in for a consultation. She'll kind of go through a plan with you. But if you've never had an infusion before, we tend to recommend 1 a week for a month because it just builds up your reserve.
Right.
And then you can just go to monthly, or if you're traveling a lot, you can have it a little bit more frequently.
Yes.
But for general wellness and health, we just recommend once a month.
Got it. And actually, there's one here that I'd like to bring up, the Tailor-Made Infusion.
Yes.
And I think that there's a growing approach to personalised medicine as an emerging practice of medicine. And so maybe tell us a little bit about that.
Yeah, of course. So the Tailor-Made Infusion. So what you will do is you will see one of our in-house doctors beforehand, and we will take a vitamin panel screening. So we look at a functional blood test, and it will look at your vitamins from A down to Z. It will also look at amino acid levels, and it will look at some of your mineral levels as well. So we send these blood tests off, and once the blood tests are back, we base the infusion on these blood tests, because there's no point us giving you something if you're in a good level of it, because your kidneys will just filter it out. So it's
and
not.
In fact, isn't there a risk if you're
Correct.
absorbing something your body doesn't actually need?
Yes, correct. So if we give you vitamins that you're already too high in, it can actually cause toxicity to the body. So that's why we like to take a personalised approach, because we can avoid giving you things that you're already too high in, and we can focus on giving you things that you're low in, and giving you things to help boost what your body actually needs rather than what it doesn't.
Makes complete sense. So when done correctly, properly, professionally, what is the actual process, Becky?
Sure. So you will always be seen by one of our GPs beforehand. So it's just a quick 15-minute appointment. They will quickly go through your medical history with you, check any allergies you might have. They will clear that you're okay to go ahead and have the infusion. And then you'll come up to our lovely infusion suite on the 4th floor, where you'll be seen by myself or one of my team of nurses. So we will then discuss with you, if you haven't already discussed with the doctor, the different infusions we have, the different types we have, what you want to achieve from the infusion.
Yes.
And we will put then together a plan if you want a plan.
So always in consultation.
Correct, always in consultation. Some people might just want a one-off because they're feeling particularly lethargic, or they didn't have a good night's sleep for some reason, but we try and put together a plan for you. What we will then do is we make the infusion on site. So a lot of places, they buy pre-mixed infusions, which they're okay, but they're not great. All of the ingredients we have over 25 different ingredients, all come in individual vials. So we draw everything up on site, nothing is pre-mixed, and this then decreases the chance of allergic reaction, or if there's something particular that you don't want in the infusion, we don't have to add it in. So the nurse will go then make the infusion for you. We will come back and see you. We take a basic set of observations, so we'll do a blood pressure, and then we put a tiny needle into the arm. It's very, very small. It's not like the big ones I used to use.
Nothing to be afraid of.
Nothing to be afraid of. It's not like the big ones I used to use in the trauma hospitals. We put a tiny needle in your arm. The first 5 minutes we run the infusion over quite slowly, because some people can feel a little dizzy and lightheaded when it first starts going through. But after that 5 minutes is up, if you feel okay, we put it open, and the infusion takes half an hour, 45 minutes maximum to go through. At all times, the nurse is available. You're not left in a room on your own. You can shout for any of us if you have any concerns, but you'll always be with the nurse in the room at all times.
What a reassuring bedside manner you have, Becky. I believe you.
I like to think so.
I believe you. Now, of course, that's if you are fortunate enough to live within a short radius of Dover Street in Mayfair, but we have a global audience of millions, Becky,
of course
tuning in. So wherever our listeners are, though, seriously, what should they look for as a minimum when seeking an IV infusion?
Of course. So, I mean, the main things to look out for are that the clinic you're going to is medically led. So you want either a nurse or a doctor administering the IV itself. A lot of clinics that are kind of popping up across the UK and in Europe are run by practitioners. So these practitioners aren't necessarily medically trained. So if there was an emergency, they wouldn't necessarily know what to do. So that is one of the main things I'd look out for. Always a medical clinic that the infusion is being given by a nurse or a doctor. And also, if you want extra safety, the clinic that you're going to, if they've got a CQC registration, which we have at Lanserhof at the Arts Club, this just ensures that the clinic is meeting criteria that the government has given to medical clinics in the UK. So
yes, this is a medical procedure after all.
Exactly. We're putting a needle into the arm, which can cause complications if it's not properly done. So this just ensures that the clinic is safe, it's clean, and it meets the basic criteria.
And it's probably fair to say that around the world, it's not as regulated as it could be.
No.
As a new and growing industry, if you like.
Absolutely not. And again, it goes back to the point where you can just go and see practitioners for this. You don't actually have to be medically trained to give IV infusions. But those are the kind of places that I'd tell you to avoid.
Yes, there's obviously obvious risk with that.
Of course, yeah.
And actually, are there side effects?
Rarely, no. So that's the simple answer. Like I said, throughout the infusion, you'll have a nurse in the room with you. So if you do start to feel unwell or you do have any side effects, the nurse will be there to help you. Sometimes, like after blood tests or an injection, you might get a bit of a sore arm where the infusion and the injection has gone in. You might get a bit of a bruise. And sometimes, like I mentioned, you may get a bit of lightheadedness or dizziness. This is because the infusion has magnesium in it. So magnesium is great for regulating sleep, which is why we like to put it in all of our fusions. But it does act as a vasodilator, so it can drop your blood pressure, which then causes the dizziness or the lightheadedness. So again, this is why we do the blood pressure before your infusion, and we'll do it afterwards as well. If your blood pressure has dropped, we'll just let you sit with us after the infusion for 5-10 minutes, get you some water, get you a drink, just until your blood pressure comes back to a normal level. But very rarely you will get side effects.
But all the more reason to be supervised medically.
Exactly.
Makes sense. Now, there are those people listening to this that swear by their supplements. Are there two camps? Can you take one as well as the other? Why do people actually need an infusion above and beyond supplements?
Sure. So it all goes back to the low absorption rate of supplementation as to why people are moving from supplementation to IV therapy. I don't not agree with supplements. I think they're great if you don't have the time to come and sit in the infusion suite for an hour or whatever it might be, but it's all down to the absorption rate of the oral supplementation v IV supplementation. The IVs, it ensures higher bioavailability. The micronutrients we can give in higher doses as well, so we can give a lot higher doses than you can fit into any oral supplementation. And you get the desired results quicker as well. So if you're taking a B12 supplement, for example, which is what many people take this supplement for energy levels because of fatigue, generally you will feel the effects after an infusion within an hour. But with supplementation, you probably have to take up to a week's worth of B12 supplementation to get that desired effect. So many people, it's convenient to have the infusion rather than have to take 10 supplements a day. But what we do recommend is alongside having monthly infusions, we offer personalised vitamin supplementation as well. So we work very closely with a company called Bionique who offer personalised vitamin supplementation. So what they do is they take the blood tests that we took from you.
Exactly the same way.
Correct. They take the blood tests, they make the supplementation based on your blood tests, and it doesn't come in a pill form. It comes in, it's called a granular form, so it's a bit like sand, so it's easier to absorb than a pill. So
that aids absorption.
Exactly. So this is more, it's easier to absorb than a supplement, and taking this alongside the IV therapy, they benefit each other very much. We would then do repeat blood tests after 3 months to look how your levels have changed, and then your supplementation is also changed based on your blood tests. So again, it's very, very bespoke to the individual. No 3-month supply will be the same because our levels change all the time. But it's just a nice add-on to support the infusion to keep you at your optimum.
Got it. Well, this all sounds very exciting, and it's a relatively young industry. And what are your predictions for the future of intravenous therapy?
I think, like you mentioned, it's very much an expanding topic in the UK. A lot of people frown upon it because they think it's a trend, like you mentioned at the beginning. A lot of people think it's just something celebrities do and they post it all over Instagram. But actually, there is lots of scientific research and studies out there now to support the IV nutritional therapy as beneficial to the individual. At the moment at Lanserhof at the Arts Club, we're also looking and trialling a new infusion called NAD. I'm not going to try and pronounce it because it's a very, very long medical word and it just won't come out very well.
Come on, Beck.
Okay, I'll give it a go. It says nicotinamide adenine dinucleotide.
Of course it is.
Something like that. If there's any doctors or scientists out there, please don't shout at my misinterpretation.
Only one take needed.
Exactly. So we'll just call it NAD.
Let's do that.
But NAD, it's a metabolite that all of our cells have. So it works very closely with the mitochondria in all of our cells in the body. As we get older, our bodies produce less NAD, which reduces our mitochondrial function. As this reduces, this can be implicated in certain health problems such as diabetes, heart disease, immune problems, obesity, and sometimes even aging itself. So by maintaining a high level of NAD in the body, this can help maintain general health and functionality. So we're looking at offering this as an infusion at Lanserhof at the Arts Club. Our lucky doctors at the moment are the ones trialling it because it's quite a long process. The infusion itself takes up to 3 hours to give. So it's something that we're looking into at the moment and hopefully we'll be able to offer in the future.
So this is the new wonder drug, Becky, potentially, is it?
No comment.
No comment. But it does have anti-aging properties or
Correct.
effects.
Anti-aging and some research has shown it's helped patients with vascular diseases, so dementia, Alzheimer's, those kind of things, because again it's all down to the aging process as we get older. But it's very much something that's given a lot in America. They use it for a lot of things, a lot of treatments, and again the UK is very slow in catching up with these places, but in the UK more people are getting to know about it and the benefits of it.
So one we should certainly watch closely.
Correct.
Okay. And what other related services do you offer, Becky?
So in regards to infusions, so we also offer something called Ozone Therapy. So basic way to describe it to somebody. So oxygen that we breathe is O2. Ozone, which is also a gas, is O3. So it's got the addition of an extra oxygen molecule. Okay. So what we do is similar to the infusion, we put a small needle into the vein and we take out some blood. So we only take out 100 mils. It's not a lot in the grand scheme of how much blood we have in our body. We take out 100 mils and we mix the blood with ozone. So we mix the blood with this gas. We then put the blood back into the body. Okay, so all of these red blood cells are now infused with ozone, which is then dispersed across the body. So again, research into ozone therapy has shown it can have antiviral effects, antibacterial effects, antifungal effects, and generally just quite good for wellness purposes.
Is this all done on the same day, same visit?
Correct.
It is?
Correct, yes.
And from start to finish, how long does the process
Half an hour. It's very quick. Yeah, it's very, very quick. And most people afterwards, they will start seeing better energy levels. They'll start seeing that I had one patient who was always prone to coughs, colds, etc. during the winter period. He noticed that this dramatically went down. So yeah, lots of different benefits for it.
Immune support.
Immune support, yeah, very much because of the antiviral effects that it's got.
Yes.
But again, this is something that's very popular in Germany, where we've got our other Lanserhofs. It's something they use very regularly there. And again, it's something that's slowly coming over to the UK and becoming more and more popular.
Fascinating. Well, look, I've really enjoyed this conversation. I know our listeners will equally enjoy it. But for those now, as a result of listening to you, interested in trying an infusion for the first time or ozone therapy or any of your other services, what advice do you want to leave us with?
Yeah, I'd say the main advice is go somewhere that is medical. So whether you come to us or whether you're not in the UK and you go find another clinic, make sure you do your research to ensure that it's a medical clinic and it's run by medical practitioners. And if you are lucky enough to be able to come to see us in Mayfair, you can book your appointments via our medical reception team. They will give you a couple of pointers to go with before your infusion, like make sure you come well hydrated, make sure you eat something before the infusion, and then we look forward to seeing you here.
Becky, thank you so much. It's been a real education and certainly a very, very interesting topic for all of us. Thanks for joining us.
Thank you.
Thank you.
Bye.
Bye.